He can catch up. Do you want to go ahead and start, Kyla?
Sure, I can go ahead and start. Let me back here. Tonight we have myself, Kyla Leonards, Chet Krauser, Cindy Farr, Jim Irvin, Commissioner Vero, Nick Holloway, Burt Caldwell, Emery Herndon, Gary Swain, Lee Bridges, MCAT, Tom Browder. That's all I see online tonight.
Okie dokie. Looks like we kind of potentially a short agenda, but well, yeah, take it away, Cindy.
Hi there. Good evening, everybody. I'm going to share my screen and go through some data. Okay, can you guys see that?
Yes. Yep.
Okay, perfect. As you can see, we are continuing to see an increase in cases. Last week, we actually thought that we might be starting to come down a little bit. And then because we were seeing cases in the under 120 a day, it was like mostly between like 110 and 120 a day. And that lasted for a good solid week. And then today we got 130 cases. So, so now we're not really sure if we really were plateauing or if we're going to be going back up. So 130 cases today. We have seen, while we've seen fewer cases over the last week or so, we've actually seen a pretty significant increase in the number of deaths from COVID-19, with 5 reported on Friday and 8 reported on Monday of this week, and we're continuing to see them coming in multiple a day. So we're up to 157 deaths so far. Normally we can't share ages of people, but because the family put it in the obituary, I can share with you that we did have someone in their 20s that did not have underlying chronic conditions that did pass from COVID recently. Sadly enough, he was 29 years old. And so the thing that the word we're trying to get out to people is that this is not just affecting people who are in their 70s and 80s and have a bunch of underlying chronic conditions. We're seeing younger and younger people in the hospital and younger people dying from COVID. As you can see, it's pretty well spread out amongst all of the age groups at this point. So on the next page, you can see that our average daily new cases per 100,000 people was down to 73. With the bump up today, I expect that that number is likely going to go up. We also, in the last couple of days, have seen a pretty significant increase in the number of people wanting to get tested. We had about a week there where we were starting to see fewer people. We were not filling up all of our appointments, and the last couple of days we've been filling up all of our appointments for the day and then having to schedule out into the next day. Hospitalizations, as you can see, we just keep hitting that record number of 3-day average hospitalizations. And we're seeing a pretty steady mix of Missoula County residents and out of county people that are hospitalized in Missoula County. And this is a graphic showing the number of breakthrough cases. That's people who had COVID or had gotten vaccinated and they still ended up getting COVID. So as you can see from this, you are about 3 times more likely to get COVID if you are not vaccinated compared to if you are vaccinated. And in general, what we're seeing is that the people that are fully vaccinated and they still get COVID, generally that's happening in older people who have underlying health conditions that cause their immune system to not respond as well. And so that is particularly why we're trying to let people know that if you are older and have risk of complications, then definitely come in and get that booster. So that is the data that I have. I will also share with you that we are changing up some of our processes for case investigation and contact tracing. And so we're seeing turnaround in fewer days. So most of the time now we are starting to get through all of the new cases that are coming in within 24 hours of having it reported to the health department. And then contact tracing is taking about 4 days from the date that the person gets tested to having all of their contacts contacted. Occasionally we have things come up where the facility that did the testing didn't give us an accurate phone number. And so sometimes in those kinds of cases, it's taking a little bit longer because we have to then go back and track down accurate phone numbers. But for the most part, contact tracing is speeding up. One change that we are going to be implementing is if you get tested through our testing facility and you indicate that you have a smartphone, or would like to have your results texted to your phone instead of waiting to get that result in the mail, we will be able to text you with those results. Another thing that we are going to be implementing is for new cases, if you indicate that you would like us to send you a web form, we can send you a link to a web form where you can just go online and fill out all of your demographic information, and all of the information that normally we would have somebody spending 15 or 20 minutes on the phone with you to collect. So we're hoping some of those changes are going to really speed up our contact tracing even further. We are currently looking at a different site for testing. Our lease is up at Flynn Lane at the end of December, but we are still having enough people wanting to get tested and coming through our facility. We're getting about 120 people a day. And so we don't feel that the community healthcare providers are really able to absorb that level of testing capacity at this point. So we are looking for a facility to move our testing into. Unfortunately, right now is not a good time to be looking for commercial real estate in Missoula. And so our options are very limited on spaces. So we will likely not be able to do drive-through testing anymore. Like if you've been to our facility for a test, we drive you through, you get education on your way in, you get tested inside the warehouse, and then you drive out. So we're having to look at changing our processes for testing. That will likely be you pull up into a designated parking space and our staff comes out and walks you through that testing procedure. That's not uncommon. That is what a lot of our urgent cares are doing as well. It just means we're going to have to change up our process a little bit because we just couldn't find a good warehouse space that would facilitate driving through. So that's the gist of the update right now. I think many of you have probably heard that Montana is the worst in the nation for COVID spread and incidence rate right now, because lots of other places are able to do mitigation measures that keep the numbers down, and we are not able to do any of that here in Montana. So the only thing that we can do is case investigation and contact tracing as rapidly as possible, and trying to get people into isolation and quarantine, and just sharing that, you know, we just need people to do the right thing. If you're sick, we need you to stay home. If you're not vaccinated, go get vaccinated. If you have questions or concerns about the vaccine, we've got folks that are totally happy to walk through all of your questions and answer everything that you're that's making you hesitant, either walking into our site over at Southgate Mall or calling 258-INFO, and our folks can certainly answer any questions. So with that, I'm happy to answer any questions you guys have.
What's the message around boosters? I'm so sorry, it's so rude of me. Emily, you should go.
Oh, you're fine.
No, go ahead.
FDA, Moderna boosters, Johnson & Johnson, that went through today. So when's that getting rolled out? Because I will gladly be first in line on Friday.
No, you
Just
can't
saying.
be first.
We can stand there and fight over it. I don't think we have to fight over it.
The FDA did put forth their recommendation that Moderna and people who got Moderna and J&J for your initial doses of vaccine could get that booster dose as well. I believe the recommendation is likely going to be the same, but last time the FDA actually made recommendations, and then the CDC changed the groups that they decided should get boosters. And so right now, the next step is that it's going to go before the ACIP, the Committee for Immunization Practices, and they will make a recommendation to the CDC, and then the CDC will take all of this information and give guidance for who they want to have those boosters. The other big thing on boosters is that now they are saying that you can mix and match the boosters. At least that's what's coming out of the FDA. Which I personally am really happy about because I had a pretty bad allergic reaction to my vaccine and was told that I really should not use that brand again because I was allergic to something in it. So I'm glad that I can get a booster with something else that maybe I won't have an allergic reaction to. And I also know that it's been really hard for people to, like find a clinic, and especially in other parts of the state. Here in Missoula, we carry all three brands, and so pretty much anybody can get whichever one they want, but in other parts of the state, that's not the case. So I think that that's good that they're able to mix and match those booster doses. Yeah, we expect or hope that by midweek next week, we'll have that guidance from the CDC and we can start rolling out boosters. If we get the guidance sooner, we are primed and ready to start taking people. So it just depends on how long it takes to get that guidance rolled out.
So I assume the other one is they're meeting next week looking at kids. And so you're looking at about a 2-week if it's similar to this decision.
Yeah.
Right?
And,
okay.
We actually had a meeting with DPHHS today to try and get some more information about that. And they said not to expect being able to roll it out to kids before the end of the month.
Bert, did you have something?
Yeah, 2 things. One is I had the Moderna, and everything I read says it's better than the others going long term, and so I plan on doing Moderna whenever it's available. And the other thing is that Emily and I can go hand in hand, and we won't have to fight.
That's great to hear.
I mean,
Tom?
we live 2 doors.
Good, I'll give you a ride.
Yeah, there you go. Thanks,
Tom?
Cindy, as always.
Thanks. I should know the answer to that. And by the way, I was a Pfizer. I had the Pfizer vaccine, so I had my booster about a week ago. And Cindy, it's a great process they have there. I mean, the web registration, everything works really well. And I should know this, but if we have an out-of-county, out-of-state person, can they get a booster?
Yeah, we are not advertising that we're allowing people to get doses here, but we also don't want to put up any barriers. And so if somebody is in town and they're visiting and they are eligible for a booster and they haven't gotten it yet, then we're not going to turn them away if they show up at our clinic.
Thanks.
Hey, Cindy, this is Jim. I wanted to ask you this at the COVID briefing today, or somebody, but I wasn't there. So I'm going to ask you. You know the at-home antigen tests that are going around, people are using? I know a lot of people who have used those recently, myself included. I'm actually home with COVID right now. But I was wondering, has the health department reached out to these retailers? And like, I was thinking maybe, just because there's a lot of people who are probably identifying themselves as positive with these home test kits and not reporting it to the health department. I wonder if there's like a flyer we could have in those retailers, just that they would hand them with the kit and say, hey, report your results, or, voluntarily, right? But for data collection purposes. Has that been talked about?
No, that's a great idea, actually. We have talked about how we could make it easier for people to report those positives to us. Right now, we're asking people to call 258-INFO, and the call takers are getting their information and passing it on. But that's a great idea, Jim. I will certainly pass that on to our PIO team and have them start reaching out. And sorry to hear that you're at home sick with COVID, Jim.
I'm doing okay. Thanks, though.
Anyone else? Anyone on the phone? Lee.
Hi, can you hear me?
Yes.
Oh, good. Okay. My question is, and this is kind of a little bit off of where we are here. If we have a medical emergency, if anybody has a medical emergency, a vaccinated person who has a medical emergency, if our hospitals are full of unvaccinated COVID patients, who has priority?
So right now, the hospitals are not triaging as far as like deciding, having to prioritize who's going to get treatment and who's not. I know that we have come very close in the last month or so of our hospitals having to start thinking about that decision. So far, whenever they get full enough that they have to think about that, they can go on divert, and what they do is send that patient to another hospital, either within our state or one of our close neighboring states. But I believe that they have some sort of a triage plan that I am not intimately familiar with, and they're doing everything that they can to keep from having to implement that plan at this point. Nobody wants to be put in a position where you have to decide that one person is going to get care and the other person is not. And I know that that has happened throughout all of Idaho. And as our hospitalization numbers continue to go up, they're definitely looking at that. But so far, knock on wood, they have not run into that barrier quite yet. But again, that's why we're really trying to get the word out to everyone in the community that, if you have hesitation about getting vaccinated, come talk to us, because we would like to give you the right information so you can make a good decision. And really part of this is, how do we keep our hospitals from getting to the point where you get into a car wreck or you have a stroke or a heart attack and they're not able to treat you because they don't have the capacity because they're so overrun with COVID. I mean, that is certainly the position that we never want to have to be in.
So you're saying that the vaccinated person with a medical emergency would be the one that would have to get shipped out of state or out of town or out of area for their medical treatment, whereas a person who chooses to remain unvaccinated has the priority of staying in the hospital? That's a tough question, but I want to know the answer. And I know you guys have had to look at that and answer that. So
yeah,
give me the tough answer.
The tough answer is that it's really first come, first serve. So if the hospital is already full, and then it doesn't matter if you're a vaccinated person or an unvaccinated person. If you have a medical emergency and the hospital is full, then they might send you to a different hospital.
If you need a triage decision maker, call me.
Commissioner Slotnick, did you have something?
Yeah, I did have a question for Cindy. So our numbers of breakthrough cases are up. And to what degree do you think this is because people have resumed living as if there isn't a pandemic, going to coffee shops, restaurants, large public events? And to what degree do you believe it's because we're still moving about with a lot of unvaccinated folks in our midst? And do you have any advice on mitigating risk as an individual?
Yeah, so I think part of it is that we are going on about our lives as if we're not in a pandemic. And so I feel like I say it every time I'm in any kind of a meeting or interview or anything. If you want to mitigate your risk as an individual, then the things that you can do are the same things that we've been saying this whole time is, if you're going to be in public places, wear a mask, whether you're vaccinated or not. Try and stay socially distanced from other people that are outside of your circle. Keep your social circles small so that you're reducing your risk of being infected with COVID, and get vaccinated. But yeah, that being said, vaccinated people sometimes are still getting COVID, and part of it is that we've got such high transmission in our community right now that we know no vaccine is 100% accurate. We all are 100% covered, and especially with COVID vaccines, there's an expected amount of breakthrough disease based on what the efficacy is. And so, it's, if you want to really, really mitigate your risk, do all of the same protective behaviors that we were doing early in the pandemic and that we keep talking about, and realize that, it is important that you could still get sick. You're not going to get as sick if you are vaccinated than as you would if you are not vaccinated. That's what I've heard from so many people that have been vaccinated that ended up getting it. And it also seems like a lot of people in our community, but it's really just because we are a small community. And so, when we know that we've had you know, a certain amount of people in our community. It feels like everybody knows someone who's had a breakthrough case, but really compared to, you know, the number of unvaccinated folks that are getting sick, it's not a super high number.
Yeah, it does seem like an interesting situation where as individuals, we have to kind of add up what's a pretty complicated algorithm around risk, because if someone decides that the ultimate risk for them is getting COVID, maybe they have lots of health complications, it could be deadly, and they really need to isolate themselves. Maybe somebody else doesn't have those things. They don't have young kids or older people in their lives. That degree of isolation could actually work against their general health or mess up their relationship with their spouse or their work or whatever. So this really seems tricky and quite individual as where you should land on that risk and responsibility, because if you get sick, it means other people get sick. And the data seems to be changing because we have never done this before to this degree. It's a very tricky situation for us all.
Yeah, it definitely is. And that is the one thing that, you know, I do feel like I'm always saying is you really have to understand what your own risk is. If you are around people who are immune compromised or who have a lot of underlying health conditions, and particularly people that are over the age of 65 tend to have not as good of a immune response, which is why the CDC is, you know, recommending those boosters. You know, then you obviously are going to have a higher, you know, level of protection that you're going to want for your own self, so that you are not passing it on to someone that could be severely compromised from it. So yeah, it's a hard juggle because, you know, we all have to get back to our own lives. I know we're a small business owner. Our family, we own a small business. We have to be able to get back to, you know, business as usual. But at the same time, I have a 4-year-old who's not vaccinated. And so we can't, you know, get back to business as usual. We want to do things to protect him. And so everybody just really has to assess their own risk and the risk that they might have of spreading it to someone that they love that either can't get vaccinated or may have not had a robust immune response to the vaccine, and, you know, and plan your life accordingly. It's hard.
Lee, do you still have your hand up?
No, I do not.
Oh, okay. Sorry.
You can lower it if it's up. Sorry about that.
Okay. Anyone else on the phone? No questions for Cindy? Or any other questions for Cindy? Thank you so much.
Thank you, Cindy.
Yep.
Really appreciate these, even if they're kind of a downer.
Yeah.
Yeah, I know. One of these days,
More information, always.
one of these days, I will come to this meeting and I will have positive information to share with you. All right, thanks, you guys.
Thanks.
Thank you,
Thanks,
Cindy.
Cindy.
So we have Nick with Smart 911.
Hey everyone. Hey, I've got some positive information for you. We have an online emergency preparedness resource to talk about. And I'd also like to mention that I'm fully vaccinated and my whole family is too, and we're proud to be so. All right,
Yeah.
let me share my screen here. So Smart 911 is, my name's Nick Holloway, first of all. I'm the Disaster and Emergency Deputy Disaster and Emergency Coordinator, Services Coordinator at the Missoula County Office of Emergency Management. And I'm going to talk about Smart 911. Unexpected emergencies happen all the time, every day. And Smart 911 is an online emergency preparedness resource that is available to all residents of Missoula County for free. Smart 911 is one piece of the puzzle for how you can protect your family. And it's all about getting the right information to the right people at the right time. That's kind of a cliche we say, but that's really what it is, information sharing in a very timely manner so that you can make sure that you get your family to safety if you need to. I'm going to try and answer these questions that you see up on the screen tonight, and then I'll take some questions for you guys. But if you stump me, then I'll go dig up the answer and get back to you as soon as I can. So what is Smart 911? Smart 911 has 3 components to it. One is a safety profile, and this safety profile is an online profile that you build using what we call critical care information, and I'll talk about that in a minute. You build that profile, and when you make a phone call, an emergency phone call to 911 on a phone that you've registered within your profile, then your profile will pop up on the 911 dispatcher's screen, and they'll be able to relay whatever pertinent information they need to emergency responders who are en route to your location to serve your family. So you want to put information in there that you want emergency responders to know, and that information could be information about family members. Well, it should be information about family members: names, ages, photos, especially if you have kids, current photos for kids who are growing all the time, physical descriptions, home information like your address. We've had people call in unresponsive and their address pops up, so we have a good idea of where they're calling from. Shut-off valves for utilities, bedroom locations. My son's bedroom location is in my profile, so if there's a house fire at my house, firefighters know where to look first to make sure he's safe. Security codes so they can get in. Pet information. Responders certainly need to know if you have a pet that may be pretty protective. Medical information, medications, medical conditions, allergies, disabilities, special considerations such as language restrictions, vehicle information, restraining orders. You know, all this is very, very private information, right? And so it's completely voluntary what you put in there. You put in there what you want to put in there, what you think you need to put in there. You don't have to do it at all, but it's a voluntary thing. And we strongly encourage it because this is a strong tool to help us help you in an emergency response. This information is secure as well. The company that we contract with uses great technology to ensure that the information is secure. But that said, you know, everything is hackable. We all know that in this day and age. The two things that comfort me about it being secure are: one, they use great technology, like I mentioned. Two, and perhaps more importantly, they never ask for any financial information as you go through the creating your profile or any time in this process. So they never ask for credit cards or bank information or anything like that. So that takes out a lot of the desire for somebody to hack in the first place. Next, Smart 911 allows people to sign up for emergency alerts, which is a huge deal. If you do nothing else in Smart 911, I would do this. You can receive alerts through text messages, through phone calls, and through emails. You can, all of those, or just whichever ones you choose, you can receive alerts. And we send out quite a few alerts, probably anywhere between 6 and a dozen on a normal quarter, 3-month period. But during wildfire season in 2017, for example, we sent out 56 evacuation notices alone. And so that's a lot of evacuation notices. That's because we send out notices for people to get ready to evacuate. That's an evacuation warning. Notices for people to evacuate. That's an evacuation notice. And then also for people to get that they're able to come back in. And so we sent out 56 that year. We also send out emergency alerts for missing persons. And when there's a dangerous suspect at large who may be armed, we ask people to remain shelter in place and lock their doors in that instance. So we send out a lot of important alerts. Now, these alerts are targeted, so they're only going to the people we think need to get alerts, because we understand that alert fatigue is a real thing. If we send all the alerts to everybody, pretty soon we probably have people dropping off the alert roster pretty quickly. So we target the alerts by geography. We go down the streets, we make a radius around a point, we do all those kind of things to make sure only the people that need to get alerts get alerts. The third piece of Smart 911 is called Smart Prepare. And this is a system that allows us to query the information. So normally Smart 911 is not searchable at all. We can't search anything in there. It's private information. We can't search it. It only pops up when you make that alert emergency call. But if you check a box that is unchecked until you check it, that says you will share your information with the Office of Emergency Management. We use that information to query the system for instances when there's an evacuation, say, and we would like to know who has self-identified in their emergency safety profile as maybe being mobility impaired and would need extra help in evacuating. So when we do an evacuation, we always check who's identified that themselves as mobility impaired and who needs extra help, and we have the sheriff's office go make sure. They normally go door to door, but we make double sure that those folks are getting the help they need. Another instance of when we have queried the system is back in 2015. You may remember there was a windstorm in October of that year, and there were a lot of power outages around the neighborhood or around the city, including my neighborhood. And power was out for, I think, up to 3.5 days, which is a long time. So when that occurred, we queried the system to see who self-identified as being reliant upon powered medical devices. So we were able to check up on those folks too. So it's a really strong, powerful tool. It's really sort of the gold standard of what it is, and we're very lucky to have it in Missoula. We have a lot of people signed up for it. There's about 24% of the county residents who are protected by Smart 911, which is great. It doesn't seem like a real high number, but it's a little more than the national average, so that's fantastic. We always promote Smart 911 during wildfire season and when there's a hazard that is threatening folks. We hope folks sign up after this presentation and at any time, but we'll let people sign up, just in time when there might be a wildfire near their house so that they get the alert they need. So why Smart 911? Well, that's easy. It's to protect your family and provide for the best possible outcome. It's just as simple as that. We really, good outcomes happen to people that are prepared. Good outcomes often happen to people that aren't prepared, usually happen to the people that aren't prepared. But when there's a difference to be made, it's when people have prepared for an emergency. So there's a lot of aspects to preparing. There's building kits and making emergency plans and making family communications plans and checking on your neighbors and things like that. But this is one big piece of it, and we hope that you take a good look at it. Now what? So sign up for Smart 911, go through the process at smart911.com. Excuse me. Click on the button that says sign up now, and it'll lead you through the process. It's fairly easy to sign up. You don't have to enter all of your information or have all of your information there at once. You can go back and sign up and add more information as you like. So go ahead and do that if you're inclined to do that. We strongly encourage you to do that. It's a great thing that gets used all the time. Share this information with your friends and family. Have those dinner table conversations about emergency preparedness, including this. And what I mentioned before, make that emergency plan, especially that emergency family communications plan, so that you know where you're going to meet up with your family. Have a go kit ready if there's a fire encroaching on your property. Grab and go, keep it in your car. Know what emergencies we face. Obviously wildfire is one and pandemic is another, but we also face flooding and a plethora of other hazards in Missoula County. And last, I just added this one, but I think it's important. Help your neighbors. Look after your neighbors. You probably know your neighbors better than the emergency responder on their way to their house during an evacuation. You probably know who might need a little extra help in your neighborhood and who might not. If you're safely able to help them, do so. I mean, neighbors helping neighbors is really one of the biggest things that can improve outcomes during an emergency. Finally, maintain your safety profile on Smart 911. Every 6 months, Smart 911 requires that you update your profile, and that if there's no changes to your profile, that means just signing in and signing out, and that tells the system that your information is current. We need to know that your information is current. Sometimes bad information that's not current is worse than no information. If you don't update in 6 months, and you will get reminded to do it by emails, if you don't update in 6 months, your account will be disabled and go dormant. It will not be deleted. You can delete it, but it will not automatically be deleted. It'll just go dormant. And the next time you happen to sign in, it'll be reactivated, and that 6-month period will start all over again, that rolling 6-month window. So make sure you keep your account current and updated. Note on that though, your account will go dormant, and when you make an emergency call, if your account is dormant, your profile will not pop up on a dispatcher screen. However, the outbound information, the emergency alerts, we control that information. We know it's accurate, so you will still get the emergency alerts you signed up for. So there's some good news there as well. Next, this last slide, we hope you do sign up for Smart 911. I would recommend that you sign up online at smart911.com and write down your password for a minute and then download the app. There's a Smart 911 app. There's an app for everything these days. Download it at the App Store or Google Play if you're on Android, and then sign in using the account you just had, and then you'll have it on your phone as well. Yeah, we just strongly encourage everybody to do it. It's a great resource that we have here in Missoula County. We're very fortunate to have. It's private, it's secure, it's free, and it's fairly easy to set up. So smart911.com. Go take a look and let me know what you think. You can find me on a Missoula County Emergency Management website if you have any questions about it. But I'm here to take questions now if you have any.
Thanks, Nick. Any questions from folks? Yeah, go ahead, Bert. You're muted.
I'm no longer muted. It's not a question. It is a statement that I got a reminder to review my Smart 911, and I appreciate that. Thank you very much.
Awesome. Glad to hear the system work for you, Bert.
It's more than, it's like the third time I think I've been a member for a long time, or since it popped up, and I like it. So.
Hey, Bert, I wasn't quick enough on the draw, but I wanted to grab this and show it to you.
I love it. I love it.
That's a COVID cup.
Of course, I've got a cup that says "Make America Rational Again."
Tom?
Yeah, so my question would be, I mean, back in 2017, Rice Ridge Fire and Sealy, Smart 911 told us about our evacuation, so we just picked up and left. Like, I don't really remember, like, for a long time, getting even a reminder to go back in. I mean, there could be a lot of us out here in the woods that, we just spaced it out. So how would we, I think you said it, but so if we went to that site, would that alone, just logging in, would that reactivate everything?
So if you let your account go dormant, if you just go to the site and log in, that will reactivate your account. Now, for emergency alerts, you should be able to get those alerts even if your account is dormant, if you've made an account, because that's outbound information. So we control that information. It's not the inbound information that we can't be certain that it's true information after a period of time.
So I do get the emergency alerts. So, it might be that some of us who maybe we're just slower. I don't know, that we need to be, just the fact we get the outbound, need to be reminded that we need to update our inbound. Okay, all right, I get it, yeah.
Okay, is your question answered, Tom? I'm not sure.
Well, so let's suppose we want to do some community awareness thing, then it would be that even if you're getting the outbound emergency alerts, you still got to go back and check it every 6 months.
Right. That's for the safety profile part of it. Remember, there's 3 parts. There's safety profile that pops up on the dispatcher screen when you call if your account is active and dormant, meaning you've updated it every 6 months or within every 6 months. There's the emergency alert component that you don't necessarily need to update the account for to get it. And then there's a safe, the smart prepare component. So I think we answered your question that you, even if your account is dormant, you're still going to get those emergency alerts. But you should
wouldn't
also
hurt to remind people that think they're still on active status because they get the emergency alerts to check it every 6 months.
That's a good point. And so they do remind folks, and Bert just mentioned that he did get reminded to update his account. So they do remind people. Now, that said, I know if you're like me, you don't necessarily check your email, your personal email all the time, and that gets a little tough. So there's a good chance. So when I get to my email, I might have 150 emails that have not been opened, and I could probably easily miss it. So that is something that you need to do. Take a look at those emails and make sure that you're getting the important emails that you need to get. But they do tell you when your account is about to go dormant. They give you about three notices before they make it go dormant, and then they'll make it go dormant. But yeah.
Got it. Thanks.
You bet.
Lee, looks like your hand's up.
Yes, and mine is not a question. It's just to thank you, Nick, for this. I've been on Smart 911 for years, and I do get those notices in my email. So thank you very much. While you were talking, I went ahead and checked my Smart 911 to make sure I was updated. So then you told me that as soon as I do sign in, it automatically renews it. So that was good to know, because I just happened to be doing that while you were talking, not to be ignoring what you were saying, but I got real curious about my account to make sure, is that up to date now? And I've had a few changes go on, so I just want to make sure. So
awesome. Good to hear it, Lee. You know, I checked my account today too in preparation for this, and I noticed there was a couple things that I needed to update in there too. So it's never too late to update it, and I'm glad that you're getting those notices.
You know, I do have one thing that I did notice that you've been asking about the COVID stuff right now. Maybe you should ask people if they're vaccinated or not.
Through Smart 911?
Yeah.
I'm not, I'm not sure that we're even allowed to ask people that.
Because when somebody comes on my property, I ask, and I have the right to know who's coming on my property with or without being vaccinated. So
that's not a HIPAA violation if they voluntarily tell you.
Yeah. The other thing is we're so concerned with alert fatigue that we don't want to use it as necessarily a messaging service. Mm-hmm. Every time we send out an alert, especially if we send one out at night, we get some pushback from people that would like to be taken off of emergency alerts. And of course, we strongly recommend that they don't. You get these emergency alerts, and maybe 90% of them don't pertain to you or your family, but that 1% or that 10% that you need to know about is the cost of getting that 10%, I guess, is getting the other 90%. But we do get a lot of pushback. So when I say those alerts are targeted, we take it very seriously that we're not sending alerts to people that don't necessarily need to get those alerts. So we don't use it for messaging like that right now.
Okay.
And about vaccinations, I'm not sure what would be appropriate there or not. I know that people get vaccination information coming at them 50 different ways every day. I just don't know. I haven't had that discussion, I guess I should say.
Okay. Well, that's a little bit disappointing, only because I'm really pro-vaccination, so I don't appreciate people being inconsiderate enough when I have a sign on my gate that says, please don't enter without a mask, no exceptions. I really don't appreciate people being inconsiderate enough to come on my property without a mask without asking ahead of time. And I've just had a lot of people do that, and I guess it's the new normal, but I just want to be honest and say I don't appreciate it. That's all. So, but that's my right. It's my property. I can
sure
say what I want. But if you can't ask that question just so that you guys know for your own safety, then that's a shame.
we'll talk about it and see what's possible. I'm not sure that that's best use of Smart 911, but we'll talk about it. We won't drop it.
Okay. Yeah, and
Thanks,
I
Nick.
don't have the answer for you. I just was wondering if that was a question that you'd be asking people, but evidently not.
Any other questions for Nick? Sorry, thanks, Lee. It's 7:15, and we still haven't got to the good stuff that I know that Tom wants to talk about. So, any others for Smart 911? If not, Kyla can take us through the information sharing.
Sure, I can do that. We'll just go ahead and open it up to questions from any of the councils. And we can go ahead and start with Swan. I see Dan is on. Dan, do you have anything tonight? Okay, we can go to Seeley. Tom? Gary?
I'm here, thank you. I will try not to be too verbose. At our October meeting, the council unanimously approved that we request Montana Fish, Wildlife and Park reopen the RV station. It's basically a waste dump at Clearwater Junction. I'm not an RVer, so I guess it's not one of the things on your radar, but since COVID, we've had an enormous spike in the number of RVs coming through our valley. And without a place for them to dump their waste, there are really two things that have jumped out at us. And in some ways, we should have been on this earlier. But with that dump being, and by the way, thank you, Commissioner Barrow, for your telling me to bring it to this meeting, because I think it is a good way to start. With that facility closed, and I think it's going on 2 years now, there are two pretty significant consequences, and my colleague in the council, Gary Swain, will probably speak to one. The most shocking one is a lot of these RVs now simply go up in the logging road, open their blackwater tank, and dump along the road. And I did not realize this, but there have been a number of people who've witnessed it. And when we think about, the core of our recreational business, that's a very bad thing, because if you're taking guests or visitors or paying customers out along a logging road and you find where someone has emptied a 75-gallon holding tank, we really don't like that. Then as we talked about it, one of our local pilots has some pictures of Seeley Lake and Salmon Lake showing some algae blooms. Now, they could be any number of things, and we know we have sewer discussions going on. But, spending a day a week during the summer volunteering at our business center, visitors center, we probably see 500 RVs a day go by, and we have over 300 campsites just from Clearwater Junction up to Summit. So the waste has to go somewhere. One of our local businesses, Lindy's, Mike Lindenberg, has had a dump station for many years, but that can't begin to service the numbers we see. So what we want to do is we have a letter drafted, which we will share with the commissioners and the other council members, anyone who'd like to see it, requesting Fish, Wildlife and Parks to reopen that dump station. I've heard quite a range of numbers and what it will cost, but the fact is, we think the argument could be made that it's COVID related. A lot of these grants, it has to be something that COVID impacted, but we saw 30–40% impact in RV visits in the Seeley Swan Valley in 2020 and again this past year. And we just think it's a good time now, especially if we get the commissioners supporting us, and we have a relatively new FWP director, just to open it, because to not do it, it's just doesn't make sense. There's a lot of local support, and our plan is to share the letter, assuming all of you agree with it. You may think it's not a good idea, but assuming you do, we'd like to share the letter with the commissioners, anyone else, for input and feedback, and then we're getting community support as well, the businesses. And Gary, I don't know if you want to speak to that, but I mean, you're part of our business community, so.
Have this figured out here.
Oh, you had it. You just muted yourself, Gary. There you go.
How's that?
Great.
All right. I think the business community would be 100% behind this. Juanita, you're in our area. You see the RV traffic that goes up. It's like every other vehicle, from May through October. And Lindy's, dump station really cannot handle everything that's going on during the summer months in particular. So, to me, this is maybe a little harsh, but it's almost neglect that is not functioning. So we're hopeful that we can, entice, not only all the businesses of Sealy, but the commissioners to look into this to see if we can't get that second dump site operating. And hopefully we can get that done by next, spring, early summer kind of thing. That will really, really be helpful and take, some of the pressure. I mean, Lindy's, as most people know, sits on the lake. So that pump station is right above Sealy Lake, and not the best of locations. The other one at Clearwater Junction is to me a much better location for the majority of the traffic, the RV traffic that comes through there. So not only do we have it all going on 200 that they could pick up, but also the traffic that's either coming down or up on 83 through Sealy. So it's a serious issue, and I know the business community would get behind it 100%. So that's. Thanks. So I think everything that Tom said is right on the mark.
And we have a professional with his hand up. Yeah, Jim Irvin. Here we go.
Thank you. Yeah. So I mean, I've been the sanitarian regulating wastewater disposal in the Sealy Swan corridor for about a decade. And I can tell you that this is a major issue. And so, FWP, I've had a couple conversations with them, and what they say is that system is too expensive to maintain. I don't know if it's being deliberately vandalized or if it's just regular expenses that is happening. I'm not sure about those details, but I can tell you for sure, Tom, that if you ask the health department for a letter of support, you would get it. And the Lindy's dump station, as a lot of you know, is undersized for the use that it's getting. It is a permitted system. It does have approvals to operate, but we do have a special management area in Sealy Lake that we have special regulations concerning wastewater disposal in the area because of contamination due to on-site septic systems, the dump station included. And so, it's a major issue. And that's the first thought that I had when I heard that FWP would not be operating that dump station at Clearwater Junction was, where are people going to put their wastewater, right? I mean, people who are, 400 miles from their home, 300 miles from their home are not going to cut their trip short because they have nowhere to empty their RV. They're going to find a way to do it just so that they can vacation. And maybe that's not true for everybody, but it's true for a lot. And we haven't had a lot of complaints in that regard, but that's probably due to the fact that the people who are illegally disposing of their wastewater are doing it in a pretty inconspicuous way. And so anyway, we support this. I think there's a lot of reasons that dump station should be operating, but I would even go one step further and say that Sealy, as a community and the community council of Sealy probably should start having conversations about how to get an appropriate dump station in that area, because the junction is great, but it's 15, 20 miles from a town where there's, like you said, hundreds of campsites. And so I feel like that's going to be the next chapter, and hopefully the sewer project will move in a positive direction, but that's got a long way to go. So anyway, let me know if you want a letter. We got your back.
So Jim, just a question related to the community doing one up closer to where we are. This idea of grant money, there's been a lot of helicopter money for everything, but if a community wanted to do that, what entity would be let's suppose FWP stonewalls us, won't do anything. It's always possible. Then who would actually do that?
Well, it's hard, right? I mean, you got to have the land, and then you have to have the money, and it's not cheap to build a septic system that would be able to dispose of that volume of wastewater, and it would have to go through a lot of review at the state and local level to get approved. So it could be done various ways. I've talked to a couple private landowners up there who are interested in trying to get something going in that way. They've had conversations with the Forest Service, who, to my understanding, has not been very receptive for money reasons. But yeah, I mean, that's kind of an open-ended question. It's hard to answer.
Josh, did you have? Slotnick, you're on mute if you're trying to speak.
Yeah, where's Nick with his cup?
Thanks, there you go. So,
Okay.
So some informal, off-the-record conversations with FWP about a year ago. What I heard was, no way, it's never going to happen. It's too much money. If you guys care so much about it, you should do it.
But it's a new day, and there's
it's a new yeah, it's a new day. There are even more unreceptive people at the state now. However, though, there is a new twist here, and that the folks in Sealy could find a much more receptive ear in the governor if they. It's going to have to be strategic, because having our support sort of looks good in some ways, but it's also kind of like having dog poop on your shoe if you're trying to deal with the state. So maybe the best thing to do is get like the most libertarian folks you could get in Sealy and have them approach the governor and FWP. And Chet just raised his hand, and he knows FWP inside and out, so can have some more to add to this. But I mean, I would think real politically strategically before you get us to sign on to it. We would if you want. That's no problem. It's a slam dunk. You don't have to worry about it, but it may actually work against you.
Chet, little history.
Oh, sorry, Juan. I think I'm having some bad connection. Can you hear me okay?
Yeah, perfect.
Okay. So I just wanted to add, I guess, to this, and I did talk to FWP this morning about this particular topic because I knew that it was going to be coming up. And I used to work for FWP, so I'm really familiar with this particular site. And I think one of the numbers that has been most recently thrown around, I think was, and it was a ballpark, but we're looking at like $500,000. And the reason being that the construction of that is essentially cast iron pipes that are disintegrating, and it's beyond repair, so it really needs full replacement. That has been the story, just to give you a sense of kind of where that's at. I do know that with some of the restructuring in FWP around recreation, they're working on trying to figure out how to address some of these recreation infrastructure issues. In fact, I think their newly hired head of that department or division within the department was there on site with some of the regional staff here a few weeks ago to look at that and start talking about it. I don't think it's on any lists at the moment for their overall infrastructure priorities, only because there's such a backlog. And I guess my suggestion would be, I agree with you, Juan, on a new day approach. I think it's just a matter of trying to make this a priority. I think if there's an opportunity to seek some funds and get some assistance, that speaks loud in both the prioritization of funds, but also in the political side of this. And I think if there could be some strategic ways to tie this need to get state investment in infrastructure, not only for this, but other needs, I think that will continue to serve the economic viability and enhancements that places like Sealy really can benefit from as well. So I would suggest maybe there's an opportunity, if a letter is pursued, to tailor that just a little bit and see what we can do as far as some collaborative efforts there. But it's definitely in need of coming back online in terms of serving that recreating public. Just speaking from the experience, that's a dollar figure that even at a legislative approval level gets very, very hard to sell. But I think it is a new day, new governor, new director, and I think it's an opportunity to build that collaborative partnership. So it bit of my 2 cents there. Use it for what it's worth, but I'm happy to keep engaged in the conversation if there's a way for us to keep it moving forward.
Thanks, Chet. And it looks like Jim, you have your hand up.
No, that's probably a remnant. I'll deal with that. Sorry.
Okay. Sorry.
So
Okay,
Juan,
Yeah, go ahead.
just want to add one thing here. When I can't remember, maybe it was Tom asking about where to look for money. If the community foundation was going to be the grantee, I would say look towards economic development. That this isn't about environmental cleanup, but it's about economic development, and that the lifeblood of Sealy is tourism, and people eventually are just going to pass by if they can't camp there. So that might be a good place to start. And there's a state organization, MEDA, around economic development that might be able to help too.
No, that's good advice. And so it sounds like, I mean, obviously health department would support it. Anybody would. I know if we come in like it's a Missoula, heavy progressive thing, forget it. And I really think, and I think Gary would agree, that with that site back open, a lot more people with a lot of money to spend would come north on 83, and they're not now because they're heading to Missoula, they're going to Great Falls or whatever. And so it sounds like we need to tweak our letter so it speaks more to the business impact of not having it. I'd still like it if it's fine with the commissioners to circulate it for your input.
Tom, I would say more free to ignore advice is do 2 things simultaneously. One, attempt to lobby FWP to restore this site and reopen it. And another one would be simultaneously work within your community to see if there's some land you all can purchase, long-term lease, whatever, and then look towards grants to how you can create one privately. And maybe you could partner with a business entity, because once this is created, that business entity who operates, it's going to make money. So it would be some type of quasi-public, public-private partnership. And so I would do both these things at the same time. And I get that there's heaps of regulatory obstacles in the way, but not to be deterred. Try both, and maybe one of them will work.
Jim?
Good. Thanks, everyone.
So I'll just put the commissioners on the spot. Is there any, I mean, I just don't, this isn't my wheelhouse, so I don't understand how it all works, but is there any way that the county could contribute or cooperate at some level with land they might own in the valley to find a spot where we could build a dump station, whether it's cooperatively with a private entity or somehow using, public dollars to fund? Has that been looked into?
Not that I know of, Jim, but I'd say, I mean, I'm just speaking for myself here, but I think it's all wide open. Like, bring us a proposal, I mean, if there's some land that might work and there's some partners lined up and you just need one piece, that's going to be a really attractive look, rather than saying, hey, we want you guys to solve this. So if there's some land we have that we don't know about, we have little pieces of land all over the place that could work. Yeah, why not? Let's dream something up.
Bert, and it looks like Chet, your hand's still up too.
Yeah, I just off the wall here. If FWP is not going to ever reuse that facility or reopen that facility, why couldn't that land be donated to Sealy Lake?
You'd have to ask FWP.
I know. I mean, if they're not ever going to use it, it's worthless to them. And Sealy Lake needs that facility. At least they have the land. And like you said, they have to refurbish it to some extent. But
Yeah, I think Montana Department of Transportation is involved with that as well. But
yeah, I think you're right.
Chet.
And I don't think that there's a lack of interest in. Am I back?
No, you're good.
Okay. There's not a lack of interest in trying to get that back up and running. I think it's just a matter of how to do that. So I don't think it's off the table at all. It's just a matter of trying to get it reconstructed. In fact, I think there'd be the potential to increase the capacity potentially there to better serve the public's use of that actual site. Again, I think all of those details would have to be worked out. I do know this came up when some of the ARPA funds were initially available, and I know there was a question from Claire at the Sealy Lake Foundation about, the next round of ARPA funds. I mean, I think that it fits into that category of a lot of additional requests related to sewer and water infrastructure that ARPA funds are being used for across the state. So this isn't a new conversation by any stretch, and I think there has been some intent at looking at potential sources of funding to fix it and bring it back on.
Yeah. Jim?
Yes.
Oh, your hand was up.
It's still up. I thought I turned it off. I'm sorry.
You got it up. Okay. It's 7:36. So how are you guys feeling? Next steps? Work with CAPS, Tom, and circulate this letter, and we'll address this with a multi-pronged approach.
No, this is great. In fact, more information, I think, than we expected. So thanks a lot, Gary and myself and the rest of the council. We'll, push this along. It sounds like it's been talked about in other groups as well. So yeah, this is really good. I think we've got a good start on what we need to do. And we have a long window because it's not until really next May when the pressure is going to build up again.
Just around the corner.
Yeah, man, I wish that was a long window in government time. That's like 10 minutes. So.
Well, yeah, I'm going to try to move us along here. Kyla, if that's okay with folks, are we able to move on to other community councils?
Sure.
All right, sounds good. We'll go ahead and go to East Missoula. Lee, do you have anything?
I don't. Not really. I mean, we're in the midst of our zoning process, and that's the only thing really on the front burner. So, and that's just an ongoing thing. So nothing really new to report at this time.
Thanks, Lee. And we have Bonner. We have Bert, Emily, and Rick on the line.
I will leave it to Emily and Rick after I ask the commissioners to get me a hard copy of our new bylaws with all the signatures. I've asked CAPS for it. They said the commissioners have it. It's online, but I want a hard copy. What do I have to do to get that?
I can get that to you, Bert. Do you want the recorded copy?
I'm sorry?
Do you want the recorded copy or just the one with signatures?
Yeah, I
do. Sure, I'll get you a hard copy in the mail.
Okay, great. Thank you.
No problem.
And Bert, just to jump in real quick, I think that's on the admin agenda for tomorrow. Is that right, Kyla?
Bonner's already signed. It's East Missoula and Rollo tomorrow.
You're right. Sorry, I'm confusing the two. My apologies,
okay.
Bert.
That's okay. I stay confused all the time.
And did you guys get my correction that y'all sent me an email that Doug Combs had not signed our bylaws, and at that same meeting a month ago he had resigned just before that meeting. So we only have essentially four members on our board right now, but we had already elected Sue Holden for our alternative. So we are, not knowing the proper procedure at this time, we are electing to put her in place until we find out our proper procedure for instilling a bona fide board member to replace Doug Combs. So would you like Sue Holden's signature on that?
She'll need to go through the process like everyone else does for community councils outside of the election cycle. So she would need to submit an application. And I think we were just waiting for the bylaws to be approved so we can advertise for the alternates and the vacant position at the same time. So as soon as those bylaws get passed, we can put out a media release for that, and then she can put through her official application.
Okay, so is tomorrow what you're saying you're doing is passing those bylaws? Is that?
They're going through the administrative process. The commissioners meeting at 10 a.m. tomorrow. I believe Lori Heyer is putting those through.
Okay, and then what happens? Do I get notified of that, or what? I mean, what?
Yeah, once they get approved and they get a signature, you'll get a copy.
Okay, great. All right, then we'll just take it from there. Thanks.
Yep.
So Rick and Emily, anything?
The firehouse is going up great.
Yeah, it looks good, doesn't it?
It looks so good.
It looks really good.
Yeah. So, and they're working on.
I'm actually waiting on the people right around the old firehouse to have their concerns raised at a meeting as to who buys the old firehouse. There's a lot of concern. Yeah.
Well, we'll increase our numbers. I said we needed drama to increase our numbers.
There you go.
That's the upside.
Always works. Always works.
Yeah. So that's they're once they move in, they said they need to get an estimate and then put it up for auction.
Last January it was appraised at $500,000. So
yeah. So that's where we're at.
Rich, did you have anything?
I got nothing.
Okay.
I think it's time to go have supper.
Is there any, Kyla, is that the last one? So are we?
That's everyone who's on the line tonight.
Okie dokie. I agree. It's dinner time.
Okay.
Thanks, everyone.
One, sorry, I'm not trying to get in the way of people's dinner. I'm just going to post and have a quick reminder on Jordan. Lyons isn't here tonight, but I know has talked to a lot of you about the housing plan. So I'm just going to paste in the chat really quick some links again. You're probably all familiar with it. There is a survey and the full plan available for public comment. So I just wanted to highlight that quickly. And now I'll let you get to dinner.
Oh, no. Thank you so much, Chet. That's important.
Have a good drive, Juan.
Thank you.
Yep.
Yeah.
Thanks,
We'll
everyone.
see you guys.
Right.
Thank
Thanks
you.
for giving us time. See you next time.
Thank you.